Always on the go, Jack Sushko suffered a nasty fall during a vacation over the summer.
Threw my back out, and my back kind of threw my hip out, and then my hip was just flat out killing me.
In the months that followed, it only got worse. X-rays revealed severe arthritis, so bad the joint had to be replaced.
What happens is the bone wears away, there becomes a pain generator within the hip joint, and you have to remove the arthritic portions of the joint and replace those arthritic portions.
Traditional hip replacement works from the side or back of the hip, but Jack's doctor planned to take his surgery in a different direction.
We were told he was doing anterior on the way in, which is the front, versus posterior in the back, and the recovery is supposed to be a lot faster.
You go through a true intermuscular plane, so we divide the muscles rather than having to separate them from the hip joint or detach them from the hip joint.
Far less invasive, and with supportive muscles intact, the anterior or frontal approach is less likely to result in hip dislocations, a possible complication of conventional surgery.
In the traditional approaches, you always had to watch your range of motion afterwards. What's nice with the anterior approach is that there's no hip precautions following surgery.
Today's joint patients have higher expectations than in years past. Sure, they want to get rid of pain, but they also want to restore function and get back to things they love.
I'm not worried about my hip at all. I go up and down 2 flights of stairs.
The first 6 weeks, there's less use of narcotics, less use of walking aids, earlier return to functional status, earlier return to mobility.
Well on his way, Jack was 6 weeks out when we met him, and it's a good thing.
We're going to be spending 20 days in Europe, and a lot of walking involved in the sightseeing.
Taking his surgery head on, he has no plans of slowing down. For Lee Memorial Health System, I'm Amy OSHIER.